This is a question for either or both of you. I wanted to talk a little bit about the relationship and what it means as far as what's coming in the future. Clinical trials. We've had patients ask about that. Is that something that community plans to participate in?
Well, we have direct access to the specialists at MD Anderson who are running clinical trials. And so right now we can call, and if we have a difficult case or if we come to a point in a disease in which there's no standard of care, and ask them if there are any current clinical trials in which the patient could be enrolled at MD Anderson. And our hope is that within the next few months we will have some clinical trials open in Indianapolis in which patients can participate without having to travel to Houston.
And also, Myra, one of the key points about this relationship that we can help the public understand is where they would get their care. Because a lot of people, when they think of MD Anderson Cancer Network or MD Anderson Cancer Center in Houston, they think they have to go there. But that's not the case, is it?
It's not the case. And in fact, that's the beauty of the relationship with MD Anderson, is that they believe that care should be provided near the patient's home. And by our affiliation with them, that enables us to provide the same standards, the same treatments, the same guidelines to our patients here in Indianapolis as the patient would receive in Houston.
Excellent. Dr. Bedano, I wanted to ask you, too, more about the collaboration, the relationship that physicians here in Indianapolis have with the physicians in Houston as part of this relationship. So we're looking at things like video conferencing with their doctors every so often to discuss patients. How does that work?
Well, we have weekly cancer conferences in which certain topics are discussed, and then experts in that particular disease type, say breast cancer, prostate cancer, from MD Anderson as well as from the affiliates, present difficult cases and approach them in a multidisciplinary form with surgeons, radiation oncologists, medical oncologists. So that's one way that we participate. We also have the possibility of peer-to-peer review in which we directly contact a MD Anderson researcher who focuses on a particular disease and can relate where we're at with the case and maybe ask for their opinion and their help in management. We also hope to, in the future, set up conferences together with MD Anderson for education of both of our own physicians as well as other physicians in the state and nursing.
You've been listening to Cancer Answers. The answers start here. Myra Fouts is Vice President of Oncology Services at Community Health Network, and Dr. Pablo Bedano is a medical oncologist with Community and an MD Anderson certified physician. Thank you both for joining the program today and sharing this important information with the public. Also wanted to let folks know that for more information on the MD Anderson collaboration with Community Health Network, you can visit ecommunity.com/cancercare. I'm Lynda de Widt.
You've been listening to eHealth Radio's Cancer Answers, brought to you by Community Health Network. The answers start here.